My name is Miranda Creech, and this is my project on type 2 diabetes. In this presentation, I'll be going over what type 2 diabetes is, how it affects the body, signs and symptoms of type 2 diabetes, treatment, and prevention of. What is type 2 diabetes? Type 2 diabetes occurs when the body becomes resilient to insulin or when the pancreas stops making enough insulin. This picture shows how glucose and insulin enters the body. In step 1, the stomach changes food into glucose. Step 2, glucose enters the bloodstream. Step 3, the pancreas makes little or no insulin. Step 4, little or no insulin then enters the bloodstream. And step 5, glucose builds up in the bloodstream, causing high blood sugar. Glucose is the sugar that is the main source of energy for the cells and muscles and other tissues. Food you consume in your liver are the main source of glucose. The liver also stores glucose. When your blood sugar levels are low, your liver releases stored glucose to try to keep the blood sugar at a normal level. With type 2 diabetes, that process does not work as it should. Instead of the cells absorbing the sugars from insulin, it builds up in the bloodstream. When blood sugar levels increase, the pancreas produces more insulin. Then the pancreas eventually cannot make enough insulin to keep up with the body's needs. How does type 2 diabetes affect the body? The cells affected by type 2 diabetes are beta cells. Beta cells are the cells in the pancreas that produce insulin. With type 1 diabetes, those cells get attacked by the immune system. That does not happen with type 2. With type 2, the cells are unable to keep up with the insulin demand. When those cells are unable to keep up with the insulin demand, it is referred to as beta cell failure. Type 2 diabetes affects many organs such as the heart, kidneys, and eyes. This picture shows on the left a normal retina and on the right a retina affected by diabetes. The effects it has on the heart are an increased risk of angina, heart attack, stroke, high blood pressure, and arteriosclerosis. The kidneys are millions of tiny vessels that filter blood. Diabetes can damage the filtering system, possibly leading to kidney failure. In the eyes, diabetes can damage the vessels of the retina, possibly leading to blindness. It could also cause cataracts and glaucoma. This picture shows a heart affected by diabetes. It says people with diabetes have a greater risk of developing cardiovascular disease caused by arteriosclerosis. Arteriosclerosis is a disease that causes hardening of the walls or major arteries of the body. Fatty material called plaque builds up within the inner lining of the arteries, causing them to narrow and be less flexible. Arteriosclerosis can occur anywhere in your body, but it is especially dangerous when it affects the arteries of the heart. Diabetics are much more likely to have stroke, heart disease, and heart attack. In fact, 2 out of 3 people with diabetes die from stroke or heart disease. Signs and symptoms of type 2 diabetes. Type 2 diabetes is often referred to as a silent killer because of its easy-to-miss symptoms. Some signs of type 2 diabetes are increased urination, excessive thirst, rapid weight loss, excessive hunger, issues with your skin, slow healing, yeast infections, fatigue, irritability, blurry vision, and tingling or numbness. Many people have these symptoms and not think anything of it because they're common issues and can mean anything. These pictures show a man that is fatigued and a woman drinking water due to excessive thirst. Treatment of type 2 diabetes. Several blood tests are used to check for type 2 diabetes. Blood sugar above 126 milligrams on both testing occasions means you have type 2 diabetes. There's no cure for type 2 diabetes, but there are treatments to manage it. Some ways to manage it are eating healthy, regular exercise, medication or insulin therapy, and blood sugar monitoring. If you are monitoring your blood sugar, you may only have to do it once in a while unless you are on insulin, and then you have to do it multiple times a day. This picture shows someone checking their blood sugar and keeping a record of their blood sugar levels. Medication for type 2 diabetes. Metformin is usually the first medication prescribed to people that can't manage their diabetes with healthy eating and exercise alone. It works by improving the sensitivity your body tissues have to insulin so it can use insulin more efficiently. Another medication called sulfonylureas can help your body secrete more insulin. Meglitinides also help your body secrete insulin, but faster. Thiazolidinoids also make your tissues more sensitive to insulin. There is also insulin therapy, which is an injection of insulin that you do yourself throughout the day. This picture shows a woman injecting herself with insulin. Prevention of type 2 diabetes. As far as prevention of type 2 diabetes, the genes you inherit may have influenced you on developing it, but lifestyle choices are much more prevalent. Factors such as being overweight, not exercising, and high blood pressure can cause a big role in the chance of you developing it. It is a preventable disease as long as you take the right steps to do so. Controlling your weight, eating healthy foods, and exercising regularly are a way to prevent it. These pictures show people exercising and eating healthy. This is the end of my presentation. Thank you for listening.